Hi, I'm Dr. Hirsch, and welcome back to my YouTube channel where we discuss all things perimenopause, menopause, and hormone replacement therapy. In this week's video, to really dig into all things perimenopause, I want to talk to you about the safety of menopausal hormone therapy to be used in perimenopause. Why it can be so helpful, when should you start it, what should you know about when it's working, and when should you ultimately stop your menopausal hormone therapy. So if you want to learn all things perimenopause, definitely stick around for this week's video. And just to get you super excited, my brand new book, The Perimenopause Survival Guide, hits shelves in October. I couldn't be more excited. Now, I wrote a book on menopause. It's called Unlock Your Menopause Type. It came out in 2023. But the thing that I realized was many of my patients were telling me that they read through that book, but they didn't really find the answers they were looking for. Why? Because they were in a whole other chapter of their reproductive lives. They were in perimenopause, not menopause. So let's first start with defining perimenopause. Perimenopause is all the time from when symptoms start to your last menstrual period. That's right, when it's been 12 months of no bleeding, that is your last menstrual period or final menstrual period, and everything leading up to that is perimenopause, and it can last for a decade. So I routinely see in my private telemedicine practice, The Collaborative. If you want more information, definitely check the description below. I really see so many women saying that their symptoms started in their 30s, in their late 30s, and in their early 40s, but they just felt like they were going round and round in circles. Nobody would listen to them, nobody would take them seriously, and certainly nobody would treat them. And the reason I wanted to write this book was because it takes on average for women to see between 5 and 7 different clinicians or healthcare professionals before they get adequately diagnosed and treated, and that simply isn't good enough. We have to do better when it comes to midlife women's health. So if you want to learn more about my private telemedicine practice, we're in almost all 50 states. This is called The Collaborative. It's the premier telemedicine practice for women who are seeking a really deep dive in all things midlife and menopause. Check those links below. Now, I wanted to start with my first promise, discussing the safety of menopausal hormone therapy. Now, I actually have whole courses for this for clinicians at the Hirsch Academy. You can also check those out, because if you are a clinician, you're going to be asked about menopausal hormone therapy, both in menopause and in perimenopause, and you're going to need to know about it. Otherwise, your patients are going to find another clinician to go to. But the cliff notes here is that menopausal hormone therapy is much safer than it was once thought, particularly because we use transdermal estrogen in the form of either a patch, a spray, or a gel. There's even a ring. And then we use micronized natural progesterone or prometrium. These are bioidentical hormones, but bioidentical does not mean compounded. Bioidentical simply means the main ingredient is a plant-based estrogen and or progesterone. And this is what I recommend for the majority of my patients. So we do want you to use FDA-approved, bioidentical, commercially available hormone therapies, such as the generic estradiol patch or the Climera patch or the transdermal estradiol spray, which is called Evamist, or estradiol gel called Divigel. These are all FDA-approved bioidentical menopausal hormone therapy. And those are the estrogens, and then our bioidentical progesterone is prometrium or micronized natural progesterone. These have been shown to be incredibly safe. They have been shown to not increase the risk of breast cancers or clots or other cancers, and have actually been shown for women who start within 10 years of menopause to allow them to live longer, on average 3.2 years, have less cardiovascular disease, less diabetes, and more. Now, if you pre-order your book, I have a free perimenopause masterclass on all of the science. If you really want to deep dive on all of this, be sure to pre-order your book, and then you can grab the link for my free perimenopause class in the description links. This hour-long course is going to take you through all the science and how safe menopausal hormone therapy is. It's great for healthcare professionals, clinicians, and just really smart women. So pre-order your book and check out that free course now. Next, we're going to discuss why menopausal hormone therapy can be so effective. Many women are offered birth control pills, which is typically a standard combination of an oral tablet of a combined synthetic estrogen and progesterone, typically in the form of ethinyl estradiol and norethindrone. And while that can be helpful for some women in perimenopause, I actually find that menopausal hormone therapy has 4 main benefits over birth control pills, and If you ask me, and I've been doing this for a long time, almost 12 years, if not more to be exact, menopausal hormone therapy seems to hit the receptors in the brain better and actually helps to more effectively treat the symptoms that are really bothering women in perimenopause, like hot flashes, night sweats, irritability, insomnia, anxiety. It just seems to work better. So let's get into these 4 benefits. Number 1, estrogen can be used transdermally. That means you can use it in the form of a patch, a spray, or a gel, as I just mentioned. Now, it does also come in oral, which a lot of women like, myself included, but transdermal allows for some women to really get major benefits, especially if they didn't like or didn't do well on traditional oral birth control pills. Transdermal seems to cause less headaches or migraines, sometimes less bloating, and it's just a little bit more gentle because it avoids first pass metabolism. So transdermal estrogen is a huge benefit of menopausal hormone therapy. The second big benefit is that you can separate out your estrogen and your progesterone. So what do I mean by that? I've coined this hormone stacking. It's when you really make a conscious effort with you and your clinician to start one hormone at a time. Because if you had a side effect from your traditional birth control pill, it was probably from either the estrogen or the progesterone, not both. It's really helpful to stack because typically when you're on a birth control pill, you can't tell if it was the estrogen or the progesterone that caused the side effect that was bothering you. But when you separate out the hormones between 4 and 6 weeks, you will really have a better understanding of exactly what your body needs and what it likes and what it doesn't. So if there is a side effect to one of the hormones, then we've got some solutions for that. But point number 2 is that when you're using menopausal hormone therapy, you can hormone stack and really get down to what hormones your body actually needs and likes. Now, the third benefit that menopausal hormone therapy has is that it comes in many different doses. This is so helpful because patients use all sorts of doses. What you need is going to be absolutely different than your sister or your best friend or your neighbor. It has nothing to do with weight or other medications or any preconceived notions that you might have about who needs a higher dose or a lower dose. But the ability to have many different doses for both the estrogens and the progesterone really allows you to much better tailor exactly what you need. And then number 4, menopausal hormone therapy has different formulations. So while we tend to start with the bioidentical formulations because a lot of women really like those and tend to choose those at first, there are different formulations. And so we use these to our benefit. The fact that there's different routes, different doses, different formulations, you can even use them at different times of the day, and you can hormone stack with them, meaning doing one at a time. This is a major benefit over the traditional birth control pill and why I typically start my perimenopausal patients on menopausal hormone therapy versus the traditional birth control pill. So the next question patients tend to ask is, when do I start menopausal hormone therapy? Do I have to wait until my symptoms are really severe? And I hear this rhetoric a lot, even when it comes to menopause and menopausal hormone therapy. I take a much different approach to this because if you are waiting until symptoms are so severe, you are derailing your health and really you're putting yourself in survival mode for so long. Think about that. That simply cannot be good for your health overall, to really just be waiting and waiting, tossing and turning and sweating it out until you think it is so bad. Because what are women really good at? Putting everybody else first, putting their care to the side, and just adjusting, putting their head down and sticking it through. If you do that, I promise you, you're not going to be in better shape. So I think the best time to start menopausal hormone therapy certainly is individualized. It's shared decision making between you and your clinician, but truthfully, it's when symptoms tend to bother you more days than not, or when they're really interfering with your professional life. Let's say you've got so much brain fog you can't think, or you have lost your motivation, or you don't feel like going to work, or you're screaming at coworkers and you're really worried about your job security. That's when it's time to start menopausal hormone therapy. The next part of this video is, how do you know when menopausal hormone therapy is working? And I have a foolproof method for this. I have 3 simple steps that I want you to know so that you can determine with your clinician if your menopausal hormone therapy is meeting your goals. Number 1, I always say if you are on hormone therapy, you should feel 70 to 80% better. Why do I pick that? Well, think about it. If you're only feeling 25% better, what's the point of even being on a medicine, something that you are picking up and paying for and doing every single day? We want to make sure that you're getting the major improvements from that medication. And there's no reason to treat you to only feel a little bit better, because when it comes to menopausal hormone therapy and your perimenopausal symptoms, they're so much more subjective than say your blood pressure or than your A1C if you're trying to treat diabetes. So I want you to feel at least 70 to 80% better than when you started. Number two, I want it to be something that fits into your lifestyle. And this is crucial. You might think this is a nice to have. No, because if it doesn't fit into your lifestyle, you will not remember or be inspired to continue to take it. And I know this because I have tried several forms of menopausal hormone therapy myself, and some fit into my lifestyle better than others. In fact, I just had a patient who really wanted to do the gel. She didn't love the patch because she was an avid runner, but she said, I just could not remember to do it every single day. So that meant back to the patch we went. And then we even went to the brand patch, which sticks a little bit better because she's an active runner. And that way she could just put that into her lifestyle in a way that worked for her. So if you're a night shift worker, if you travel a lot, if you have ADHD or you forget things, you have to find a regimen that's going to fit into your daily life. And number three, you have to feel really confident about your hormone therapy regimen, because inevitably someone's going to tell you at a Christmas party or at your doctor's office that it is trying to kill you. And you want to be able to back up your confidence in the safety and efficacy of your menopausal hormone therapy, why you're taking it, and what it's doing. You know, in my private telemedicine practice, we get to spend so much time with our patients because the confidence in what you're doing and putting into your body is absolutely crucial. And we want you to know how safe your menopausal hormone therapy is, what are the red flags you should look out for, and we work with you every single step of the way to ensure that you feel comfortable with the way we're tweaking your medications or even where we're sending your medications. Everything is important. And lastly, when do you stop your menopausal hormone therapy? Well, currently both the American College of OBGYN and the National Menopause Society, or the Menopause Society here in the United States, says that there is no longer any time limit to the use of menopausal hormone therapy. And I could not stand by something more confidently, because once you're on your hormone therapy, there is no reason or need to stop simply because you reach a certain age. This is very outdated. So if you still have a doctor or clinician that says you can only take that for a few years, or you're gonna have to stop when you're 55, or you're gonna have to stop when you're 60, tells you some other crazy myth that you don't see here on this channel, you just simply smile and say, I think that is outdated information. In fact, it was in 2015. So that is almost 10 years or more, you know, when we really believed that menopausal hormone therapy could be used as long as the patient needed it and it was still safe for her. So stopping it just because is something that actually came from the Women's Health Initiative, a study that came out in 2002, and that has been debunked. Meaning, if you start your hormone therapy within 10 years of menopause, and this includes perimenopause, you can take it as long as it is still safe, as long as it is still meeting your health goals, as long as it is still meeting your priorities, and you and your doctor still feel like it's the right fit for you. All right, guys, I hope that was really helpful. I wanted to jam-pack everything about perimenopause into this video, but I do have a whole perimenopause playlist. Absolutely, feel free to binge it, learn everything you can, and don't forget to pick up your copy of the Perimenopause Survival Guide. Let's create a whole perimenopause movement, because there is so much to learn about our bodies, and I want to help be a leader in making you feel comfortable and confident in what's going on with your body. All right, guys, leave me a comment below. What did you learn? What do you want to know next? And I'll see you next week for a brand new video. Bye, everyone.